Hi, I'm David Williams. I'm consultant anaesthetist at Morriston Hospital.
I'm Ian Josty, consultant plastic surgeon.
I'm Claire-Louise, I'm an anaesthetist.
And I'm Ian Pallister, a consultant orthopaedic trauma surgeon. Well, we have formed a little surgical team to go and help with work at a hospital in Haiti. It's the Milo Hospital, which is a hospital which has been supported for some years by an American charity. On a monthly basis, a surgical team goes out to help with the care of patients in general terms, but also specifically following the earthquake. And there are still large numbers of injured patients as inpatients in that hospital. So our goal will be to go and help assist an American surgical team, which will consist of about another 8 or 10 people, consultant surgeons as well as anaesthetists, scrub staff and so forth. And we will be in Haiti for a total of a week, actually working on the ground. At present, we've made all of the travel arrangements ourselves and so forth, but we've already had some generous support from local businesses and individuals as well to help defray the costs of the travel and so forth. And we've also been assured of help from industry for use of certain implants that may be helpful for cases where more complex limb salvage is going to be required. Well, a huge amount of work has already been done dealing with the acute injuries in the early phase, and a lot of that work was done from an American military ship, a military hospital ship that was in the locality. Unfortunately, with such a high volume of casualties, there are inevitably going to be complications, both from the injuries themselves and also from the initial surgery. And we will be largely dealing with that sort of second peak of activity. So complications from original trauma, perhaps some people who never even made it to hospital, which is sometimes the case in circumstances like this. We expect to be working pretty much flat out. To our best knowledge, there's still approximately 250 trauma inpatients at the moment, and so we'll have to strike a balance of doing ward rounds with the American team that's there to prioritise cases and get them through into surgical care as swiftly as possible.
I think one of the good things about us going out together is that we're used to working as a team, and it's common for plastic surgeons and orthopaedic surgeons to work together to optimise outcome in patients with chronic limb injuries, and it's also excellent that we're working with anaesthetists who have the same work ethos as ourselves and we understand each other's way of working. So I think hopefully, provided we still get on at the end of the week, we'll work effectively and well together.
Haiti is the poorest country in the Western Hemisphere. It has horrendous rates of infant mortality. About 1 in 14 children die before the age of 1, and most adult males don't live beyond their 50th birthday.
This was
yeah, before the earthquake happened, there's a lot of medical problems and social problems on the ground there. Very high rates of HIV, malnutrition. So I think any help that we can give will be useful.
And I think one of the things that we have to remember is that what we're doing is a minuscule drop in the ocean compared to the scale of the problem out there and all the other agencies which have been involved from the outset. You know, we're doing something because we've got some skills to offer and some time to do it, but there have been over 350 organisations working in a coordinated manner as much as possible to serve these people, and I think we have to be humble as we go out and be used with our skills, but be used as they feel they need to use us as well, isn't it?
Absolutely. One advantage of going out with the hospital concerned is that they're accustomed to having visiting surgeons coming over, and so we will not be starting from scratch. We'll be fitting into what's actually quite a well-trodden path, and as Ian says, hopefully what we've got to offer will then be optimal.
Basically, for me, it's an opportunity that I've been waiting for, I suppose. Never had the chance before to go and do something like this, and I think it's a chance to go and do it, as I say, with people that I know, so it's not as daunting as it would be to go by yourself.
Another thing that we'd like to do, if we have time, is to do some teaching, because whilst it's great if we can go over there and perform a series of operations, we'd like to leave some sort of legacy that would enable the Haitian people to stand on their own feet and to gain skills. So if we can find time between the operating lists, we will be spending time teaching the local people.